5 years previous to Richard actually successfully taking his own life, he had attempted a suicide before, which was a complete and utter shock to all of us at home.
So he hadn't been outwardly struggling with his mental health before at this point?
At that point, we had no idea, and we didn't know what signs to look for, which I think is a large part of the problem that's out there now.
In 2016, Steve and Chris lost their son and brother, Richard, to suicide. Their lives fell apart. 10 years later, with Richard's memory in their hearts, they are fundraising for suicide prevention charities Reach Out for Mental Health and Maytree by climbing Mount Snowdon. Their team will stop on the journey to the summit and at the top to reflect and to perform songs. Here, Steve and Chris talk to Kirsty Eaton, founder of Reach Out for Mental Health, about Rich as a man, the red flags they feel were missed by medical professionals, what needs to change in the NHS approach to mental health, and the signs families and friends need to be aware of if they are concerned about a loved one's state of mind. Trigger warning. This is a difficult watch. If you need emergency support, call Samaritans on 116 123. Reach Out for Mental Health offers free counselling and befriending services for people in Essex with suicidal thoughts who are not yet in crisis. Go to their website, reachoutfmh.co.uk, to find out more. And please sponsor Songs on the Summit to stop more lives being lost to suicide. You can find their GoFundMe page or have a look on Facebook.
Chris and Steve, tell us about Songs on the Summit. What's the point of Songs on the Summit? Where does it come from? What's it in aid of?
So basically, we want to raise money and awareness for mental health. We've got two charities specifically we're raising money for, which is Reach Out for Mental Health and Maytree Respite Centre. We thought it'd be great to get people together to do a climb up Snowdon in Wales. And on the way up, we're going to sing songs. We're going to, basically perform songs together, 2 or 3 songs, and then one on the summit when we get to the top. And it's about sort of sharing the journey together and making a hard journey easier by sharing it together.
Sharing the load.
Yeah.
Where did you get the idea from? Who thought of it first?
I'll tell you what happened, 10 years ago when we lost our Richard, a few of our friends and Chris went on a charity walk up Snowdon. I wasn't able to do it at that time because I was really quite ill in hospital, having major surgery on my stomach, and I always regretted the fact that I wasn't able to do that walk with them. So we like to raise funds and support the charities because it means a lot to us now to try and help other people cope with and possibly prevent other people going through what we have. So after talking to Chris, he said, well, let's do it again, but this time we'll add the guitar and we'll call it Songs on the Summit.
Obviously we both have something quite tragic in common in that we've lost someone to suicide. I lost my colleague Steve in 2015. And as you mentioned, you lost your son Rich in
2016.
2016, yeah. Tell us a bit about, as much as you're comfortable with, about your experience as far back as you like regarding Rich and how you lost him and the circumstances around it.
That's a tough one to know where to begin. I really don't know where to begin with that.
Okay. So Rich had, much like my friend Steve, he'd struggled with his mental health for a number of years, and frustratingly, despite the fact that we keep insisting that, because we know men are most at risk of dying by suicide, we're always trying to encourage men to talk about their feelings and open up and discuss if they're struggling. We've been banging on about this for 10 years. And Steve did. He went to hospital, he went to his GP, he asked for help openly on many occasions, and he didn't get that support that he needed. And from what I understand, it was a similar thing with Rich as well.
Yeah, you're correct. Because 5 years previous to Richard actually successfully taking his own life, he had attempted a suicide before, which was a complete and utter shock to all of us at home.
So he hadn't been outwardly struggling with his mental health before at this point?
At that point, we had no idea, and we didn't know what signs to look for, which I think is a large part of the problem that's out there now. We're not educated. Nobody's really educated in what the warning signs are, what to look for. Someone says, oh, I'm feeling a bit down, I'm feeling really miserable, and I don't know why I'm here. And they say this sort of thing, and the tendency for all of us is to shrug it off and go, get over it, you know.
Pull yourself together.
Yeah, you'll be okay. When really that isn't the case, and it's poor education in general, I think, yeah. So we came home one day, and his car was parked funny out the front, and we thought, that's odd. We came indoors, and our neighbours came in, a paramedic was called, the police came, and the paramedic patched him up with, just bandages and stuff. An ambulance never came. In the end, the police car said, right, enough's enough, we'll take him down. And they took us all to A&E, dropped us off outside, and that was it. We were left to it. Even when I went in and pleaded with the people, behind the counter, we were in an emergency situation, I was told I needed to be quiet, go to the back of the queue and wait. And I said, love, we were waiting for an ambulance. They wouldn't have it. And then finally, he got taken in. The upshot of that was he was left on a bed thing, again, strapped up temporarily for about 5 days.
5 days?
5 days. We got transferred from there to another hospital. He didn't get seen by any psychologist.
I was going to say, was this a mental health unit or
No,
was this like a general?
This was a general hospital. We got transferred where they said he was going to need surgery 5 days before we got any assessment. And now I had to argue. I really had to argue. And they said, well, it's not an emergency anymore. I said, it's been an emergency now for 5 days. He's on his back with his arms in the air, and he can't move. He hasn't moved, and he's not been assessed properly, So finally he was, and then they stitched him all up, and the process of getting the use of his hands back and all that took several years. He had to have all sorts of therapy and stuff, but I mean he did make a good recovery over a long period of time. So here's again another part of the problem. We believe, because having been through that, and he swore blind that he didn't understand himself why he did it, and that he would never ever do anything like that again. We believed him. We totally and utterly believed him.
Do you think that he meant it at the time when he said it?
Yeah, I do. I do believe he meant it. And he made a really good recovery, not only physically. I mean, he went on to train at the gym. He became a personal instructor. He did very well at work. He became engaged to be married. He'd saved up, and him and his fiancée saved up and put down a deposit on a house. Everything was going really well. So we all thought that everything was good. And then one day while he was at the gym, he overdid an exercise and really hurt his back. And from that injury, he then started obsessing on the fact that he thought he would not get better properly. The doctors gave him diazepam. Now, according to diazepam leaflets that are in the box, anybody that's had any history of depression should not be given diazepam. And to my mind, that is where this thing went really horribly wrong. Because within days of him taking the diazepam, his depression got worse and worse and worse. And in the end, he wasn't even talking properly. 5 weeks from that injury and to the time when he actually took his life. Yeah. Despite the fact that we took him to the doctors numerous times, 3 times in the week before.
Why did you take him to the GP? What was his? What was
Well,
Rich
we
like?
took him to the A&E. We took him to the GP.
What, because
he,
Rich stopped talking?
he couldn't sleep either. He wasn't sleeping.
I thought diazepam knocks you out though.
Oh, none of it was working.
He was having muscle relaxant. They put him on, but he basically he was saying he was really down, wasn't he, then as well?
On top of the diazepam, they gave him sertraline. Yeah, and on top of that, when we went in the week prior to him taking his life, he was telling them that he wasn't sleeping at all and he had terrible headaches. Yeah, they gave him a sleeping tablet, and then 2 days later, when we went back and said he's still not sleeping, they gave him another sleeping tablet. In the end, they'd given him 3 sleeping tablets, and he still hadn't slept. So by the time he took his life, he'd been a week without sleep. Yeah, he was in a real state. We tried our very best to be on top of it, to be with him, to take him to the doctors. We did everything that we were told to do. We actually had him booked up to go and see a private psychologist. We'd even tried there to get him seen a week earlier, and they said they're sorry, they couldn't fit him in. Yeah. But the very morning that we did have him booked in was the morning he got up before the rest of us did, slipped out, and that's that. So we weren't aware that anybody that had had a history of depression was more, a history of attempted suicide. We believed him when he said he would never do it again. We were never warned by any official or anyone in the medical profession that he's actually more at risk of doing it again. One of those doctors that we took him to in the week previous said, well, look, if you don't mind waiting a few hours, we have got a specialist nurse. It might be worth your while having a chat. But this is a day before we've got him booked up to see a private, consultant. So you think he should have said, "You need to see, not if you want."
It's important that you do.
Yeah. So we felt like we were let down there. The problem was that none of those doctors, every single one of them, only had 10 minutes with him. I think that when we went to the coroner's meeting, the coroner said, "What a shame! There's such a break in, a lack of communication between the medical departments."
This could have been prevented.
It should have been, yeah.
Yeah, it felt like it was any time he went to see someone, it was disjointed from all the other times he'd been.
Just take another sleeping tablet.
It's the easy fix.
It's like, they each time they look at it as a fresh, okay, what can we do today, rather than seeing the whole thing and being like, this is like, how many visits was it within like 2 weeks? It was something like he'd gone to the doctors or the hospital like sort of like 8 to 10 times or something within a few weeks, where it was so bad that he just was desperate. And it's like every time he's sort of been let down because they've not looked at the whole situation and said, like, this is what something drastic needs to happen.
Even if we go back to the first attempted suicide, which was 5 years previous, it took over a month after coming out of hospital before anybody came round here to see him. And there was like a month gap in between that visit and the next visit. And guess what? It wasn't the same person. So the counsellors, there was absolutely no consistency whatsoever. None. And during all of that time, no one attempted to educate the rest of the family. If we'd have been told then, be warned.
Be vigilant. Yeah.
And these are the warning signs to look for. Since it happened to me, I did some research of my own, and I found a document, a PDF, that was a guide to GPs and nursing staff of the 10 warning signs to look, or 10 warning signs to look for, 10 red flags. When I read through it, Richard ticked 8 out of the 10 boxes, and we didn't know. So why are they not flagged up on, the medical records? Why is it that you can go to one place and they don't see a common record? I don't get it.
Yeah, massively. And I think that's, looking back on how you and I, and our first exchange, when you and I first spoke, when I decided, after Steve died, I wanted to create a service that was there for people that were feeling suicidal, that wasn't A&E or 999 or Samaritans. Samaritans are fantastic, but they can only do so much. And I wanted to create something specifically out of hours for people to go to get support. So I end up volunteering at Maytree, the suicide respite centre that you guys are wonderfully raising money for with Songs on the Summit, along with Reach Out for Mental Health. And I remember being on shift. I remember being on the phones. And I remember speaking to you. And I've always found it really hard to speak to somebody who's bereaved by suicide. More than speaking to someone who's suicidal. And I don't know if that's obviously because of my own experience or what, but I remember speaking to you and you said where Rich took his life. And obviously Maytree's in North London, and me being living in Stamford at the time. And it was in the newspaper as well. It was quite kind of high profile what had happened. And I remember you mentioning that people were referring to Rich as a diamond geezer.
Yeah. And
I remember coming off the call and just being in bits and Googling it and obviously reading about the whole incident, because you weren't calling up to tell us about that. You were calling up because you were frustrated and pissed off, rightly so, about the system, and you were saying to me that, you know, something needs to change.
I had just feeling guilty that I couldn't help him like he needed. And yeah, just sort of thinking back and thinking, why didn't I like give him a hug then, and why didn't I sort of try and comfort him more? And yeah, I've just a lot of what ifs and a lot of guilt, and just it's really hard to like have to try to get over that, I suppose.
I was with him on the times we went to the doctors 3 times in the last week, and I keep saying to myself, why did I not just say, no, this isn't good enough?
When we talk to individuals that are accessing our service, Reach Out for Mental Health, when people access us to get the counselling service, when they're under assessment, you know, they'll tell us, or our team, things that they've been holding on to, sometimes for decades and decades of trauma, of grief, of various bits and pieces. And they say that they've been hanging on to it and have never wanted to talk about it, or, you know, certainly wouldn't go to their GP and say that they've been having suicidal thoughts for fear of being locked up, for fear of being sectioned. So I think to kind of reassure you, and I know that there's nothing I can say that obviously is going to change anything and that's going to particularly mend the hole in your heart, but I think you could have said, I'm not going anywhere until you get us, you know, the relevant support, or until you get us a referral to this service or that service.
I'd have probably been arrested. I'd have probably got the bed for the night.
Do you know what?
Yeah. I believe that's right.
Yeah.
You know, the only one thing that all of them had in common is they did say to Richard, do you think you're, you know, likely to hurt yourself, or you've got feelings of self? And he said to each and every one of them, no. Yeah? And that was it. They took it, and I believed it. Myself, I believed it.
It's so hard assessing that, though. I mean, like we've got a fantastic clinical team, and when we train our student counsellors on how to work with individuals that are suicidal, obviously we're used to working with people that are suicidal. We're used to having those conversations. It's just what we have. But in terms of having suicidal thoughts, you know, they're quite common. They're quite low risk. Being able to talk about them will make it so much better. It's more risky if someone's got suicidal thoughts and they don't feel that they can talk about it. So being able to have those conversations is 100% life-saving. But yeah, we've got like a whole protocol of what to say to really get to the point to understand whether or not this person is actually actively suicidal. Because as I say, suicidal thoughts, they're quite common. You know, they're not particularly dangerous. But to find out if someone, A, have you thought about how you would do it? Have you got access to means? Do you know when you would do it? You can't just say to somebody, have you got thoughts of killing yourself? Have you got any intention of harming yourself? No. Next question. GP surgeries had taken on the, oh God, I want to make sure that I get it right. I think it's Detroit. They had a massive suicide rate. It was through the roof. And they tried something really pioneering where, and again, I think it was men. I make you right, obviously, men and women, we're all, you know, our lives are of equal value, but because we know men are more at risk, it was kind of profiling, I suppose. And if they had somebody, if they had a guy that was coming in of a certain age, of that demographic that was at risk, whether they were coming in because they had erectile dysfunction or constipation, they would sit there and talk about their mental health. And it worked. To say, I'm sure it was in Detroit. And this thing was massive. You can Google it. And then...
Well, they just spoke to them about their problems for a little while.
Yeah, they actually made
yeah.
An extra appointment and had some extra time in there to talk about their mental health and really ask, maybe 3 times ask. When we talk about making every contact count, if you've got a guy that's coming to the GP, you've got him, you've got a captive audience there. Make sure that you find out exactly what's going on for him. Don't ask once, ask twice, ask maybe 3 times exactly what's going on. There are so many easy ways that we can start capturing and intervening before it gets to the point where we're losing people left, right and centre.
When you consider how much a suicide can cost after the event, surely the prevention and these other things would be saving money in the long term. I know in Richard's case, the number of people and the ambulances and the fire services and everyone called out and all the police that were out looking, how much did that one incident actually cost? My guess is probably over $1 million. I don't.
Average, it's estimated that every suicide costs $2 million. And it's horrible to take it down and to really kind of crystallise someone's life when, in a purely monetary way, it actually leaves like a metallic taste in my mouth. But, you know, they look at the tax that Rich now hasn't paid, considering that he might have worked until he was 70. You know, all of the tax lost. They say that a suicide, don't quote me on this, I believe a suicide affects directly and indirectly 130 people. Because it's not,
imagine.
It's ripple effect. It goes on and on.
I mean, there's his fiance's family for a kick-off. Richard lived with them for several years. So the effect on them is probably just as profound as it has been on us.
And, you know, for a long time, there's been a lot of funding. We've done really, really well with regards to funding, working within suicide prevention. But in the last year, it's kind of disappearing. So when I started, there was bugger all. That's why I started it. If there was something there, I wouldn't have bothered setting up a charity. But again, there's more charities, there's more support that's there, and the money that we're all kind of drawing from, that pool of money, is just slowly kind of diminishing. And yeah, it's difficult. I mean, you can't say that, you know, heart disease is less important than suicide prevention or diabetes or, you know, focusing on children's mental health rather than crisis.
I think it just feels like there are things that could be done which wouldn't cost hardly any money.
Massively.
And it's just a case of like processes and maybe information, education, those sorts of things, which I think which they could implement, which really wouldn't. It would just be a case of creating new processes. Yeah, exactly.
Yeah,
which like could like save so many lives, and it's just a case of like having that education put out there, having better processes in place, things that could be adjusted, which doesn't cost money, doesn't need, you know, extra therapists to be paid or things like that. It's just a case of them implementing new procedures.
So that would be if you were to be able to write down some recommendations of what you think would help. It would be to make sure that records are transferred or
and
readable in
and-
real time.
and any risk factors and red flags should be there in bold and looked at.
So making sure that records are transparent, making sure that there's a clear flagged system for argument's sake, if someone's made a suicide attempt, even if it was 10 years ago, not to prescribe certain meds.
Yeah.
What
Proper
else?
assessments,
Proper assessments,
not just do you feel that you'll harm yourself.
and then take their first word for it.
Yeah, it's like it's been put down like a huge, complicated, mental health issue has been boiled down to one question and a one-word answer. Like,
Yeah, exactly.
it's like how is that effective? Like that's just not effective. It needs to be broader than that, and there needs to be other things in place, definitely.
I mean, regretfully, all of us in the family believed, because he'd attempted it once and he'd said no, he would never do it again, we believed that. And yet all the evidence out there points the other way, and we weren't aware of that. So part of our mission now is to help other people to understand and to research for themselves and find out what the warning signs of somebody who's suicidal is.
I mean,
Particularly if they've got somebody that they've has said to them, oh, they're feeling down and depressed, because it's easy for us, or the rest of us, to shrug it off and think, oh, get a life, get over it, you'll
be
all
all
right.
right. Yeah, just having a bad day.
I think that's why sometimes I feel guilty, because I feel like the few days leading up to it, I did see massive warning signs, but I didn't feel like there was anything else I could do. I was trying to.
And to be
talk
honest,
to
Chris, I
everyone.
don't think there was anything else you could do. I don't think
I
we
mean,
all did
he
what we
was
thought
like-
was right at the time.
I remember us like going like for a walk through the woods, and I don't know how we come onto the subject of it, but we were talking about how like certain people have their like ashes buried into like roots of a tree and stuff like that. It's like a spiritual thing, and he was like, oh, I really like that idea, and he really made a point of saying, oh, I really like that, and that was, I was a bit like, that's odd that he sort of really wanted to talk about that. And then like I was like, oh, now I'm living by these woods, we can like come out, go camping. And he was like he just went quiet and didn't answer, and then he was like and I was like, don't you think, and I actually had to ask him again, I was like, don't you think we could come camping out? And he was like, yeah, and he sort of looked down, like it was like,
And this was a few weeks before
this
his
was
death.
like a day before,
Couple of
day or 2 days before. And I was like thinking, that's not right.
We knew he was in trouble that week. We tried our level best to be. We was with him as much as we possibly could. In fact, that night, during the night, he got up. He transferred money from his bank accounts. He had a company account. He sent them back the money that was in there, and he put the balance. He did all his bookwork on that very night. So
this wasn't an impulsive decision. This was planned. He knew.
well,
Yeah, and this is another thing. Like a couple of days before, he was like, I remember him wanting to go out. He was like, I want to go out for a walk, and this is where we was like trying to like stay with him like as much as possible. He was like, I want to go, and I was like, why? What do you want? And he was like, oh, just want to get out and go for a walk. And I was like, I remember thinking like, no, like I don't think like.
Not letting you out of my sight.
It was like, yeah. And then I think I said, and we sort of was like, no, you don't need to go out, like, it's fine, like, we'll stay with you, or something happened, and that was like, to me, like, he was saying, like, he was, like, trying to get out of, do you know what I mean, get out of the way, sort of thing. And so that's why I feel like, sometimes, like, what makes me feel more guilty is because I think, like, I saw these things.
you did
But what
prevent
could you
him
have
from
done?
going out there walking. Exactly. What else
He
could you have
got
done?
up. He got up when everyone was asleep.
Yeah. And Chris wasn't.
Well, I
even
remember-
Unless you
at-
could
I
unlock
remember
the
that-
door
I remember
and
the, like,
hide the key.
The night, I think it was either the night before or on the night, I was like up at night and I was thinking, like, I think I'd sent him a text and I was thinking I should go around there because I just don't, like, I felt so worried. Like, I literally remember, like,
He was.
the 2-3 days before he did it, I was so worried. Like, I was up at night, like, thinking I should go around there and just stay with him, like, because I was really that worried. Like, I really thought, I really was worried that he was going to take his own life. I was really worried for that. And then yeah, and then obviously he did, and it was just like, it made me feel really guilty that I could have done more.
What could you have done? Would you have slept in his room? Would he have let you?
No.
If you said, I'm going to get the sleeping bag and I'm going to sleep in your room, he would have told you to do one.
Yeah.
There was nothing else we could do, Chris. So he was with us all the evening. We was with him 24/7. But while we were asleep, he did get himself up and basically he tricked us all into what he did. And we believed that it was the day that we had him booked up to
That's
go.
what's really interesting. So he
go
knew
and-
that he had the appointment at Nuffield.
Yeah. Mr. Gary Jackson. I don't know if
And
you know of him, but he was.
I think
he
he'd
was
been to him
absolutely
before,
brilliant.
and he'd helped him before. Like the 5 years earlier, I'd helped him, and he had obviously put him on certain medications and things. But they actually did get him out of the sort of cycle he was
That
in.
man was on a different level.
Yeah,
When we weren't getting anywhere with the national health, you know, with the 1 month between therapists coming round, we booked up and we took him to see Mr. Jack, and it was hellishly expensive. I mean, it was unbelievable, the price, but it was worth every penny.
Mm-hmm.
And we were willing to go down that road again because, you know,
Because we was feeling like he's not, and it was like we
turned
was
him
desperate.
around.
We was desperate, and then so we thought, get him this appointment, and all of us were just thinking, get him to this appointment. That's
We've
really
just got
going to
another
help.
week. We've got another week. We just need to
It
keep
was a
him safe
day.
for another week.
when he did what he did, it was because he felt that he
was desperate. I
was
think.
desperate.
Yeah.
And it is an
But-
illness. We have to look at it. Well, he was a very.
It feels just
sick-
so. It's just so.
Yeah,
It's
yeah.
like it's like sickening to your core. Like to think it could have been prevented. Like that if the right things had been in place, and if there'd been better help and better
It should have never
assessments.
got anywhere near. That's nowhere near. It should
Like
have
with all the
been-
red. Like I mean, obviously it's horrible with any suicide. Like it's like absolutely devastating. But there's some that just come out of nowhere,
Mm-hmm.
and it's like. But with him, it felt like there was this lead up to it, like where it was like there was all this stuff happening, and we was really trying to get. Felt like there couldn't have been more. It couldn't have been waved in front of the doctors and the hospitals and that faces
Yeah.
any more than it was. Like
No.
it was like right there, and it felt like it was still like hitting your head against a brick wall. With like there was just, even though we was all worried, even though he'd been there, he wasn't sleeping. There was all of these things there. It was like, it just feels like such a kind of blindingly obvious like case of like this person needed like immediate help, needed more than what he got.
Can I ask? So you said that Rich, you know, there was, you know, it was premeditated. Like you say, you transferred the money, and the day before he died, he was still poorly, quiet.
No, he'd been out and about with us, and I think, in hindsight, that it was his way of saying goodbye.
This is it. This is what I want to talk about. You know, you say you wanted to have more information, and that more information needs to be made available to the friends and family of those who have made an attempt. Something that I wasn't made aware of until I started obviously working in this arena is a massive flag for any individual who has been feeling suicidal in the past. If they then suddenly, like you say, start going out, maybe a bit more talkative, feeling a bit calmer, maybe slightly chirpier, you know, that is a flag that person may have then made a plan, because like you say, they're doing their goodbye. They've made peace with it. They know that they haven't got to endure this pain, whatever it was that was going on for Rich, Steve, whoever else that we've lost. They know that their end is coming. And so there's a lightness that they experience. And then they get to enjoy those last few days, hours with their friends and family. And I think that is one of the key bits of information. If we can get this put out, and to make sure that everyone's aware of that, I think that could potentially save some lives. And
But
there
then,
was-
even if you have that information, and there needs to be something there for like action needs to happen. Do you know what I mean? So it's like, even though like say there were certain red flags there that we sort of was, and we was all really worried. Like, and even if you sort of knew, if we knew about that more, like, it feels like it wouldn't have made much difference. Any like, do you know what I mean? If we'd have said this has happened, like, it's gonna, like, are they gonna do? Like,
Short of cable tying ourselves to him.
yes,
What else
yeah,
can
yeah,
you
yeah,
do?
yeah. Like,
Like-
you're saying, kind of bolting the door.
Yeah, like he
shut.
needed to be like maybe sedated even to like give him his mind
He
peace.
should have
Like,
been taken in weeks before and given a respite. We need somebody hasn't slept for a week. My God, he should have been taken in and put under
yeah,
to give his body and his mind a
Rest.
rest. That's what he needed, and that's what he didn't get.
Yeah.
so like I think you're right. I think that the information needs to be there so people can recognise it, but also there needs to be actionable things that can happen to, like, if you're concerned that way, then there are things to support you and to actually help prevent someone in that situation, like, because
Well, look, can you imagine
it feels a bit like, even if you're like, oh, you know, even if we was like 98% sure that he was going to do it, like, it felt like there weren't things in place that could have sort of helped him still.
So what resources are there for them, and how difficult is their job as well? I mean, it's not an easy
It's not
side
easy.
of the fence for them to be setting on either,
No.
and then they've got to live with the fact that
How many patients have they lost?
maybe I could have done this. I often think about those 3 doctors. You know, they must have that on their conscience.
So, was there any recommendations that came out of the inquest? Did anyone take responsibility, or
No.
what was the fallout from
No,
that?
it was very much like,
The magistrate said, "What a shame there was a lack of continuity between the different doctors that he saw."
That was it.
That was it. Verdict: he killed himself. Case shut.
How did you guys feel at the end of that?
Devastated.
it felt, I was like, it feels like absolute, like, everything to you, like, you're like, it's consumed your whole, like, world and everything, and you're going to this inquest which is extremely stressful and everything, and you're going thinking that something might come of it, like maybe they'll, like, I thought it's going to be like, you know, serious repercussions here, like something's going to change.
Someone's going to be held accountable.
Someone's going to be held accountable for this, or there's going to be. But it was literally like, it couldn't have been further from that. It felt like it was just like, you know,
Along with God knows how many thousands of others.
it was just kind of like case closed. Like, as soon as that, without any, you know, they weren't going to put anything on the doctors that.
We weren't the first, and we won't be the last.
It's gone off.
Should we stop now?
Yeah.